This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today I'm going to talk about how to fix golfer's elbow. So golfer's elbow, which is pain kind of on the inside of the elbow, right at this bump here, it's also called medial epicondylitis. It can often be a really aggravating source of pain for people that golf or do other sorts of sports. You don't have to do golf to get this. A lot of people that get it don't play golf, but because of just association with golfing, it's called golfer's elbow. So what is it exactly? So all the tendons that let your hand flex and let your wrist move down attach all to this point along the elbow right here called the medial epicondyle. The ones that all extend attach to the lateral epicondyle, and that's for tennis elbow, but we're just going to focus on the inside right now. So sometimes those tendons can kind of get degenerated. It's not so much an inflammatory condition, it's more that the tendons kind of get worn away, kind of like a frayed piece of rope. And that can cause pain anytime you kind of grip or anytime you flex your wrist, especially like playing games like golf. So the question is, how do you get rid of it reliably? Unfortunately, one of the best things you can do is stop doing the activities that cause you all that pain. If you just notice it while you're golfing, you may need to take a little bit of time off before you can get back. But you don't just want to sit there and do nothing. There's also some good passive stretching and exercises you can do at home to help with that pain as well. But yet resting, you can also ice it and try anti-inflammatories as well. Usually those things will kind of help the pain go away. If it's really bothering you, then what you can also do is wear a wrist splint, which keeps the wrist in a neutral position, and you can wear that during the day. And I would say also at night as well, to prevent the strain that comes from moving it. What that basically prevents you doing is it prevents you from doing those movements that cause the pain and allow it to rest. Steroid injections are sometimes done for golfer's elbow, although not as common for tennis elbow, which again is on the outside. But we'll do them on occasion, and they can tend to help a little bit. But most of the time, it's just a game of physical therapy or home exercises, rest, and anti-inflammatories. There's not really any sort of magic bullet with golfer's elbow. There is a surgery that can help kind of clean that tendon out. Not done super commonly. It's done a lot less than surgery for tennis elbow, but that is an option in case all else fails. So I hope I was able to answer your questions about how to fix golfer's elbow. If you have any questions for me, feel free to leave them in the comments below and I'll be happy to respond. If you like this video, we put out new content every Friday, so please like and subscribe, and thanks for watching.